Hi everyone, welcome back to my channel. Today is part 2 of the episode on miscarriages. Today we are going to talk about the different types of miscarriages that are there and what your OBGYN is likely to do for you when you get one of the miscarriages. I hope this episode is going to inform you. Thank you so much for joining. So first and foremost, it's important to understand that the different types of miscarriages are managed in different ways, and this strongly depends not just on the symptoms that the patient is experiencing, but also on how far along the patient has gone on the gestation. So for pregnancies that are extremely advanced, the patient is likely to be induced or given medication to stimulate the pregnancy to come out, especially if it's non-viable pregnancy. However, for earlier gestations under 12 to 14 weeks, it's likely that the patient undergoes a surgical procedure to clean out the uterus or takes medication to be able to allow the pregnancy that is non-viable to come out. So let's head on straight to the different types of miscarriages. The first we're going to talk about is a threatened miscarriage, and this is a miscarriage that has not actually happened but is likely to happen, and it could go either way. It could either end up happening and being a complete miscarriage, or it could end up continuing and the pregnancy could actually go to full term. So this is when a woman experiences bleeding during pregnancy, and when an ultrasound is done, they may find that there's a small clot between the placenta and the uterus that may either stay the same or shrink or expand to actually remove the entire pregnancy. So it's a threat to the pregnancy, but the pregnancy is actually still viable and does have chances of continuing. For this particular cases, what we do as OBGYNs, we give the patient complete bed rest. She's not to move, she's not to do any strenuous activities, she's to avoid heavy lifting and sexual intercourse, and we're likely to supplement her with progesterone to allow the uterus to remain calm and not to start contracting to actually expel the pregnancy. And then we have another type of miscarriage, which is the inevitable miscarriage. This is a miscarriage that is definitely going to happen. So the fetus may actually be viable. However, there are many things that are noticed on ultrasound, and within hours it's likely that the fetus will be non-viable. So it's a miscarriage that is definitely going to happen, and these are the ones that are the trickiest to accept by patients because the pregnancy is actually still alive. However, your gynecologist can tell you with certainty that it's actually going to end. We diagnose these with ultrasound. There's certain features that we see that are going to tell us that this pregnancy is actually going to end, and we try to manage them medically, but sometimes we have to evacuate the uterus with a surgical procedure in theater. For miscarriages that are evacuated in theater, there's many times that the patient is going to need to be admitted, may need to stay in overnight, or it could be a day procedure. However, admission may be necessary. So if you're having that kind of miscarriage, or you know somebody who has, you may want to keep an open mind towards admission. Another type of miscarriage is an incomplete miscarriage. This is a miscarriage where part of the pregnancy has come out, but there's a part still remaining that hasn't come out. So it's a non-viable pregnancy. However, the uterus isn't completely empty. There's still pieces that have remained. And for this kind of miscarriage, it's best to have the uterus evacuated surgically or cleaned out in a theater. However, some patients do still choose to have medication to allow the uterus to contract to be able to expel the remaining pieces. The problem with this kind of management is that if after the medication the pieces are still left behind, you may still require the surgical procedure to completely clean out the uterus. And then we have miscarriages that we call complete miscarriages. This is when the entire pregnancy that is non-viable comes out with no remaining pieces inside the uterus. We diagnose these on ultrasound, and most of the time there's very little management that is given afterwards other than pain medication and possibly antibiotics to prevent a future infection. Another type of miscarriage is a missed miscarriage. This is a pregnancy that has already ended but has no symptoms and was not noticed to have ended. So many times a woman is continuing with her regular antenatal care and she goes to see her OBGYN, and when the scan is done, it's found that the pregnancy is actually no longer viable. So we call that a missed miscarriage. There's again two ways of managing it depending on how early or how late this occurs. It can either be managed through medication or through surgical evacuation or cleaning out of the uterus. And the last and possibly the most dangerous type of miscarriage is the septic miscarriage. And this is when not only has a miscarriage of any kind occurred, but there's also an infection that is happening at the same time. This could be an infection of the uterus, of the cervix, or even of the membranes or the tissues that belong to the pregnancy. Most of the time the patients have fever and vomiting and severe abdominal pain, they have bleeding, and the problem with such pregnancies is that when we choose to clean out the uterus or to evacuate them surgically, there's a very high risk of rupturing the uterus or tearing it because it's so weak from the infection and even damaging other organs in the abdomen. Such patients always require admission. They're going to require IV antibiotics, they're going to require fluids, and sometimes this could end up having other consequences such as thromboembolism or forming a clot in your lower legs. It could end up in an endotoxic shock situation with a HDU or an ICU admission. It could end up with other organ injury, as I had mentioned before. These patients may require high-level care in hospital, and these situations could even result in future infertility. They need to be handled with a lot of care. The diagnosis needs to be made very early, and as I mentioned before, possibly the most dangerous kind of miscarriage that's there. It's interesting to note that such miscarriages actually happen because of illegal abortions, when unsterile equipment is used, when unqualified personnel carry out termination of pregnancy, and this generally leads to a septic miscarriage. If you know anyone who's had this kind of miscarriage or is having that kind of miscarriage, you need to report to them to hospital immediately, because the correct management could actually save their lives. I hope this episode, these 2 episodes, have made you understand about miscarriages, have dispelled some myths for you, have made you understand when a pregnancy is actually over and when it isn't, and I hope it makes it much easier for you if you were to ever undergo that, or if you need to help a friend who's had a miscarriage understand the situation. Thank you so much for joining your free consult, and see you next Thursday.